Good evening everyone, and welcome to the MQ Health Wellness series. And tonight we're going to cover the topic of healthy weight. Many of you will have attended previous seminars and will be familiar with the format, where we'll have a number of speakers, and we'll also then at the end have an opportunity for you to send your questions through electronically, and we'll try to address them. Firstly though, I'd like to, on behalf of all of us and the various places that we're meeting from, take the opportunity to acknowledge the First Nations people of Australia and their elders past, present and emerging, and also to acknowledge any First Nations people who may be present here tonight or in the extended audience on the webinar. My name's Simon Wilcock and I'm the Program Director for Primary Care and Wellbeing here at MQ Health, and I'm a practicing general practitioner. When I graduated more than 40 years ago now, I had learnt a model of medicine that was what we call disease focused. So I learned about heart disease, I learned about diabetes, I learned about lung disease and many other medical conditions. And I learned that people develop these conditions and my job was to identify them, put a label on them and then treat and hopefully fix them. But the modern paradigm for medicine is to actually help to prevent people from getting many of these diseases, many of which are actually the end point of poor lifestyle choices, or even for people who have better lifestyle choices, acting on genetic and occupational vulnerabilities that they may have. We also understand that people don't just have physical health, they have biopsychosocial health. So what's happening in their communities, in their daily lives, how they're feeling emotionally, all of those things can affect their health significantly. Multidisciplinary teams with people who have, as I said, multiple factors affecting their health. We need multiple people to manage them. I don't have a full skill set. I might be able to diagnose something, but there's a whole lot of information and advice that I don't have easy access to, and I'm not sufficiently confident in providing advice to my patients. But I'm lucky enough to work with a team of people who do have those skills, and that's really going to be the basis of our presentation tonight. You're going to hear from three speakers about three different aspects of healthy weight. It's called healthy weight rather than dealing with obesity or being overweight, because again, we don't want to present this in a medical paradigm. We want to present it in a this is all of us paradigm. All of us can have issues with our weight. All of us have the opportunity to take measures to manage our weight effectively and thereby hopefully prevent the development of serious disease. Also very important, I think, to mention at this stage that it's important not to stigmatise people who have weight problems. Weight gain is a medical problem, but it's also a social and psychological problem. And the design of the program tonight is to acquaint you all with all of the sorts of services that we can muster to help people manage those issues. Our first speaker tonight is Valentina Duong, and Valentina is one of our geriatricians, one of our dietitians, wrong seminar, one of our dietitians here at Macquarie Health. She's an accredited practicing dietitian who specialises in weight management, sports nutrition, body recomposition and mental health. And it's really interesting to notice that in a modern team-based care model for dietetics, there's a focus on things much more than just diet, but including things like mental health and body composition. Through providing evidence-based dietary advice, innovative strategies and support, Valentina helps you build lifelong habits and a healthy relationship with food. It's also worth noting that she's an international powerlifter and she understands the importance of nutrition in improving performance, productivity and mental health. So thank you for giving us your time tonight, Valentina.
Thank you so much, Simon, and thank you to everyone who is here today. I'm Valentina and I'll be running through balanced eating for a healthy weight. We'll be talking about how to make sustainable changes to improve your physical and mental well-being. So today we'll run through what is healthy eating, what does a balanced plate look like, the best diet to live longer and healthier, what works better than eat less and move more, and then finally the 5 secrets to sustainable weight loss. So what is healthy eating? This is a question I get asked a lot in clinic because sometimes there's so much information out there, we're not sure what healthy and normal eating even looks like. So a healthy eating is a regular eating pattern. So it's something that we do consistently every single day. And I find that the biggest mistake that individuals make is that instead of having consistent meals, they're grazing throughout the day or they're skipping meals. And if you are someone who finds that you either overeat a lot at the end of the day, it's likely because you're undereating during the day. So it doesn't matter if you're having 3 meals a day or 6 meals a day. You want to consistently be having meals at similar times each day. We also want to include a wide variety of nutritious foods from our 5 food groups. So if you have a look at the the graph on the side, we'll be looking at the 5 food groups. The first one being our grains, but we want to go for mostly whole grains. So things like our multigrain bread, our sourdough bread, our whole wheat pasta, our couscous and quinoa. Next, we want to go on to our protein foods. So things like our lean meats, our fish, our eggs, our nuts and seeds, our legumes and beans. So these are really important because they provide us with the ability to build muscle and maintain muscle. Next is our dairy foods and alternatives. So this food group provides us our protein, our calcium and our phosphorus, which is really important for maintaining our bone health. So if you're someone who chooses not to have dairy, that's okay. You just want to be making sure that you're having calcium fortified alternatives. And the best substitute for dairy, if you are someone who doesn't eat dairy, would be a soy alternative that is fortified in calcium. Next, we all know that we should be having 2 pieces of fruit a day. So 1 serve of fruit is a medium-sized fruit, or if you're chopping it up, a watermelon or a rock melon, it's about 1 cup of chopped up fruit. Next are our veggies and legumes and beans. So we want to be having 5 serves of vegetables per day. And what that looks like is 1 cup of raw vegetables, or another way to do 1 serve of vegetables is half a cup of cooked veggies. So what that might look like in a day is maybe at lunchtime you've decided to have a big salad and you're going to do 2 cups of some lettuce, tomato and cucumber. So that's 2 serves of vegetables. And maybe at dinner time you're going to do a nice chicken stir fry with some basmati rice. And so with the stir fry you're going to cook 1.5 cups of cooked veggies, and that's going to be 3 serves. So altogether that's your 5 serves of veggies for the day. And another part of healthy eating is meeting your energy, protein and micronutrient needs. So this is really individualized, and it is based on your genetics and the way you're moving your body. And so it's really important that you are getting tailored advice from a dietitian for this. And meeting our needs are really important because it supports our immune system and our physical health. It helps you feel nice and energized. It enhances your mood. It prevents chronic disease. And it also provides us a connection to community and culture. So what does a balanced plate look like? So we want to have half a plate of our non-starchy vegetables. So when we think about vegetables, if you think of starchy vegetables, they're things like our corn, our potato, our sweet potato, taro, cassava, and green peas. And every other vegetable you can think of, we consider that non-starchy. So we want half a plate of non-starchy vegetables. We want a 1/4 plate of that really important muscle-building lean protein. And then finally, we want a 1/4 plate of our low GI carbohydrates. So these are our whole grain foods and our starchy vegetables. So things like our multigrain and sourdough bread, our legumes and beans, our potato, sweet potato, corn and pumpkin. So with these low GI carbohydrates, they're providing us with nice and stable blood sugar levels and also balanced energy levels. So one of the diets that has really stood the test of time, which we really can't say for most diets, is the Mediterranean diet. There's a lot of evidence that it improves our blood pressure, our cholesterol, helps with glycemic control, so our blood sugar levels, and also helps us with weight management. The Mediterranean diet is mostly plant-based, so that means it's mainly from fruits, veggies, whole grains, legumes and beans, and nuts and seeds. So if you look at that pyramid on the side, you can see that at the bottom is our whole grains. And there's a lot of diets out there, especially the keto diet, that tells us, oh, carbohydrates are terrible for us. But we can tell that as part of the Mediterranean diet, we're choosing high quality whole grains. These are a really important part of the diet, especially when we're including fruits and veggies and legumes and beans and nuts and seeds as part of that. We also want to be choosing locally grown seasonal foods. So this is not only really good for our bodies, but it's really good for the environment as well. We want to use olive oil as our main healthy fat, and we want to include fish and seafood 2 to 3 times a week to give us a good dose of those heart-healthy omega-3 fatty acids. We also want to include protein at our main meals from legumes and beans, chicken, turkey, eggs, yogurt or cheese. And importantly, we want to limit our meats and sweets to less than 2 times per week. So we often get told, well, just eat less, move more. But the problem with this is it's not just how much we eat, it's what we're eating that matters. So what I prefer to say is to eat more high fiber foods and to move more. So we want to be having lots of low energy density foods. So the things that are the basis of the Mediterranean diet, which are our fruits, vegetables, and whole grains. We want to include foods that are high in fiber and water at each meal to keep us feeling satiated and satisfied. Because one of the reasons that most people fall off track in their diet is because they're feeling too hungry. So this helps manage that hunger and helps us feel satisfied. Research actually shows that including a soup or a salad as an appetizer before your main meal can reduce the energy intake of the entire meal by 20%. And over time, this does have a meaningful impact on body weight and body composition. I want to touch upon cultural foods because I do believe that cultural foods are a part of healthy eating. And yet we keep being told that they're too calorie dense or too high in fat, or I don't know what's in that, so I better just avoid it. I think that's a shame because cultural foods can be extremely healthy. They are often based off locally grown and seasonal foods. What we need to do is use the plate model to adjust these portion sizes to make these traditional foods still healthy and a part of a healthy diet. So I'm Vietnamese, so I'm going to go through a traditional Vietnamese food that often gets demonized. So that's beef pho. So beef pho is the picture that you can see right there on the slide. And the main protein for that is lean beef, which is a great source of protein and iron. It also contains low GI carbohydrates if you're using fresh rice noodles. So that's, again, really important to give us that energy, but nice and stable energy and blood sugar levels with the right portion size for you. So if you're thinking about using those dried noodles that you're going to boil, those are higher in GI, so we're better off using the fresh noodles. And then finally, pho has lots of high fiber veggies as part of it. You can see that there's bean sprouts, onions, mint, and basil. So what you can see here is that traditional foods can be a part of a healthy diet, and there's no need to avoid cultural foods because we miss out on delicious food, a connection to our culture and our family, and we also miss out on a big variety of plant-based foods. Slow and steady wins the race. The key is patience when it comes to weight loss. What's really important is that you're making small changes consistently over time in order to achieve sustainable weight loss. What I often see when individuals come to the Healthy Weight Clinic is that, they've jumped on fad diets and, they might have lost 10 kilos in 2 months, but unfortunately within the next 6 weeks, 20 kilos has piled back on. And that's not what we want to see. We want to see that weight slowly coming off and you being able to maintain that weight over time. So what I say is to aim for a 200 to 500 gram weight loss per week. You might notice that in the first and second week that it's a little bit bigger than that. You might have a kilo, maybe 2 kilos, but it should taper off and you should be aiming for about 200 to 500 grams of weight loss per week. It's really important to remember weight loss is not linear. We should expect and accept weight fluctuations. So things like water intake, exercise, salt or sodium intake, how much fiber we've had the last time we went to the bathroom, that all impacts our weight. So there's no point in weighing yourself multiple times throughout the day. Instead, what we're looking for is a trend line that goes down over time and stabilizes at a healthy weight. We also don't want to play the shame game, get stuck in that binge and restrict cycle. We want to meet our mistakes with self-compassion and curiosity. We want to ask, why did this happen? And what can I do to stop it happening again? Is there any patterns that I can see? Do I tend to overeat because I'm bored or because I'm stressed? Is it late at night? Is it early in the morning? We want to address your relationship with food and identify triggers for overeating. And it's really important that we're doing that as part of a holistic team that we have as part of Macquarie Healthy Weight Clinic. where we have an endocrinologist, an exercise physiologist, and a dietitian to help you manage hunger, create sustainable lifestyle changes, and to meet your energy, protein, and micronutrient needs. Thank you so much for listening, and I look forward to answering your questions later on.
Thank you so much, Valentina. You made the very clear and an important point that maintaining healthy weight is not just as simple as eating less and moving more. And thank you for giving us an excellent background in terms of that will enable us to make healthy food choices. Along the same vein, we're now going to have our next speaker, Carly Trichokovsky, who's an accredited exercise physiologist who's going to talk to us about the way we move and the way we use our bodies. Carly's an accredited clinical exercise physiologist who's passionate about using physical activity and exercise prescription for injury prevention, rehabilitation and weight management to enhance overall physical and mental well-being. She completed her Masters at the Australian Catholic University, where she led the Exercise Physiology Clinic. While she does continue to teach, her roles now are largely client-focused here at MQ Health, and she has interest in specific conditions such as diabetes, heart disease, cancer and chronic pain, and as we said at the introduction, how the way we use our bodies can impact upon the management of those conditions. Thank you, Carly.
Thank you, Simon. Happy to be here today. So just to start off with, I'm going to talk about appropriate movement and exercise for our health, including maintaining a healthy weight for health status and the long term. So the benefits of exercise that we'll go through are enormous. So to start with, I just want to touch on the term physical activity and what it actually consists of. It's important that physical activity is referred to as the umbrella term, so it encompasses both incidental activity and structured planned exercise. All of this movement during the day counts towards healthy weight and lifestyle improvements. So as an example, our incidental activities include things like our chores, walking around work, and then specific structured planned exercise is our run, cycle, and typical gym sessions. So it won't be a surprise to anyone that as a population, our exercise habits took a hit during lockdown. The emerging research is indicating that over 50% of all populations reported reduced levels of physical activity. We lost our incidental activity when we started working from home, studying from home and homeschooling, and in a study across 4 major Western countries, it was actually young Australians that scored the lowest for structured physical activity engagement during lockdowns. We saved so much time on travel, almost 200 minutes per week, where we could have picked up a new hobby or learnt a new language. But as we didn't have many places to go, our moods dropped, and what majority of us did instead was worked more, snacked more, and sat for longer. Research is finding that the reduction in step count alone is roughly equivalent to a weight gain of 1.5 kilos per person. In addition to reduced physical activity levels, weight gain and the risk of increased disease, a recent Australian study of over 500 participants reported the additional factors of increased loneliness, increased feelings of loss of control over our life and our health, mental health concerns such as depression and stress increases, and poor nutritional intake, so increased snacking and soft drinks. These are just to name a few of the effects experienced, and the comparison of pre-COVID data indicates participants have not yet returned to our pre-COVID levels. Why is this? Because returning to a pre-lockdown exercise routine is difficult. Since the lifting of restrictions, many physical activities such as exercise groups, social groups and sports haven't or are only slowly reopening. Although in these environments so much is being done to reduce the risk, the possibility of infectious disease is still present, and for many this is still keeping them away. Last month, 30% of Australian adults reported that they were back exercising at a gym or playing sport, which was a 5% increase from June last year. So although we're getting there, we still have a way to go. Exercise is the single most important and affordable way to improve your health. It is now being prescribed in the prevention, management and treatment of majority of physical and mental health concerns. So the science is clear. Regular physical activity is essential for improving our health and maintaining this for the long term. And I'm sure it's not news to anyone that exercise is good for you. But the benefits extend beyond body image and having stronger muscles. Exercise plays a significant role in improving and maintaining your cardiometabolic health, such as reducing your blood pressure, cholesterol and blood sugars, to reduce the risk of developing chronic diseases such as cardiovascular disease and diabetes. This leads to a reduced risk of more significant health events like a heart attack or stroke, letting you live a longer and improved quality of life. Exercise also plays a significant role in improving mental health and well-being through reducing stress and anxiety. Considering that 41% of Australians have reported a reduction in mental well-being over the last 2 years, it's as good a time as ever to start adopting some good exercise habits. Now that some of the benefits of physical activity are out there, and you're probably thinking, well, how much do I actually have to do and what exactly? Because there is a lot of media, some research back and some not, out there telling you a lot of different things. A good place to start is the Australian guidelines, developed by health professionals and based on research. To maintain good health, we should be aiming for 150 minutes or more of moderate to vigorous intensity activity. So that's about 30 minutes a day. And this aerobic exercise is what we commonly know as our cardio activity, so something like a brisk walk, jog, swim or cycle. And then resistance exercise is what we know as lifting weights or strength exercises. It is recommended to complete at least 2 days of resistance training a week, targeting most of our major muscle groups. So these can include either at-home exercises or our gym-based training. To maximize weight loss, the recommended dose of aerobic exercise then increases to 5 hours of moderate to vigorous intensity exercise a week. But please remember, we don't start here. These numbers should help form our end goal. They're research backed, but we need to start with what's achievable. I'm going to run through a process that I encourage you to take if you're not sure where to start or if something's not working. It's often how I'll approach meeting somebody new in the clinic. First and foremost, you need to identify your current activity levels. What does it look like? What does a day look like, or a week? How much do you move? The average Australian spends over 9 hours a day sitting. This increased an additional 2 hours over the COVID period. So think, is this you? Do you have prolonged periods of sitting, maybe at your desk, at work, or in the car? It's a good first place to start. Prolonged periods of sedentary behaviour, so our sitting or lying down, is an independent risk factor for negative health outcomes. Once you've identified whether this is you, it's time to make a conscious effort to break up the sitting. What we know is that sitting for over 60 minutes at a time is so much of an issue that it can diminish the health benefits that you've accumulated in that 30-minute moderate bout of activity that morning. During a typical day, try to implement regular periods of standing, stretches, sitting on an exercise ball, move your legs up, down, to the side, raise up on your toes, and include more intermittent walking. So once we have an understanding of our activity levels, we need to find out what's been stopping you. We have more barriers now than ever, and we are still 10% short of our pre-COVID exercise levels. So before you can get started, you need to be honest with yourself in identifying what is it that's keeping you from starting. Exercise is definitely not a one-size-fits-all model, so have a think. Is it time? Is it motivation? Or is it an injury or lack of knowledge that's stopping you from going to the gym or going out for that walk? I think one really important thing to note is that people often don't prioritize exercise until they have a reason to. And even then, it can be hard to stay motivated. The problem with this is that we then often only exercise as a treatment or rehabilitation as opposed to prevention, which is what we really want. Some tips to get started and consider if some or all of those barriers resonated with you is to maybe start with a step goal. So start with aiming for at least 5,000 steps a day, gradually aiming to increase that towards 7,500 and 10,000. These are numbers that have been found to be significant. Pair exercise with a hobby or something that you already enjoy. Can you put some music in, put a podcast on, put your favorite webinar on? These things will make it a lot more enjoyable for you to stick to. And if it's an injury that's holding you back, I highly recommend that you do consult with an exercise physiologist. They can work with you to find the right strategy on how to overcome those barriers and fit exercise into your lifestyle. So next up is, once we've started, well, how do we keep it up? Because here we're aiming for exercise in the long term. In order to succeed, we need to set goals and invest in our health. This looks different for everyone, but if we don't set goals, how do we remember our why when we start losing motivation? We typically use the acronym SMART goals, but for today, I'm just going to focus on the last two letters, R for realistic and T for time-based. It's great to have long-term goals, and yours may or may not be similar to the guidelines I mentioned before, but it's so important to set short-term, realistic goals of what you're going to achieve and when you're going to achieve it by. For example, I may want to run half a marathon, but at the moment I'm not running at all. So for me, I might set a goal of running 3 times a week for 2 kilometers each time. And in 2 weeks, I'm going to check in with myself and plan for the next few weeks. This is much more realistic and much more likely to keep me on track than if I simply said, my goal is to run a half marathon in December. That's never going to happen. Over time, this goal setting becomes much more fluid, but it is important to come back to our basics and reassess when we're not sticking to what we set out to do. If we're not keeping them realistic and we're not adding in time frames, we often get lost, start too ambitious from 0 to the guidelines and beyond, and it's just not sustainable. So start small and start achievable. Once you're started, we need to make sure that we keep it going and putting time aside in your week to catch up with yourself and go over your exercise activity goals. This might be a sit down with yourself and your notepad and ticking them off, but it might simply be a check-in on your way home from work. We need to keep exercise and health targets at the forefront of our minds, and when we review, make sure we're going through what's working and what's not. It's no different to how you problem solve other areas in your life. What's preventing you? Can you find a new strategy to solve it? If you were able to stick to your initial plan, that is great, but for a lot of people, getting started again is trial and error. Talk about it. Do your friends know? Do your family members know? Do your work colleagues know? The more people that are on board with your ambitions and your goals, the more likely they're going to check in with you about them, and the more likely you are to stay on board. Again, they're going to help you keep it front of mind. Last one of these is to use what's available. So there's so many exercise apps and tools to track activity out there, but my advice is to start simple. Use what you're already using. Do you use a diary or a calendar in your work or your personal life? If so, put your exercise or your goals in there so exercise is fitting in with you and not the other way around. If you prefer your phone, start checking your daily steps or pedometer app. So, the saying that you can exercise anywhere is true. I mean, you might not be able to do vigorous activity exercise in the office, so we'll say it's true for the most part. It's important to remember that both aerobic and resistance exercise don't need to be done in the gym. You can exercise at home, utilize online programs, go to the park, or start up a new sport at any age. Or maybe you could even try that activity that you've always wanted to do. I believe in exercise, but make it fun, or at least meaningful to you. It will make you much more likely to stick with it, again, in the long term. So the last bit of information I want to leave you with is the importance of resistance exercise, because this is the key to aging well. Research tells us that we lose 3 to 5% of muscle in each decade after 30, and resistance exercise can help prevent this. Specific benefits of resistance training include improving your bone density, which reduces the risk of osteoporosis and fractures, preserving muscle mass, promoting positive body composition changes, so increasing your skeletal muscle, and increases your metabolism for longer. The most effective exercise for weight loss and ongoing maintenance of a healthy weight occurs in combination with diet and includes a combination of aerobic and resistance exercise. All right. Where to go, where to find more information. I've included a few resources here. So the Heart Foundation Walking Group. It's a free, social, and it can keep you on track. Most sessions most days in all different suburbs. There's even one in Macquarie Park on a Friday if any of you are interested. Local aquatic and leisure centres, so Macquarie University Sports and Aquatic Centre is a good example. There's pool, gym, group exercise classes and trainers and exercise physiologists there to give you the help and advice you need. Check out your local council. They often have exercise classes, activities, different events and park exercise. Lots of resources online, and if you are wanting some well-backed information, Exercise Right has information as well as workouts on there for you. And definitely here at MQ Health, we offer individual assessments to meet your health goals. So that's it from me today, and I will be around to answer any questions a little bit later on. Thank you.
Thanks so much, Carly, for providing us with both a rationale for the importance of exercise and mobility, but also some tips to how to achieve those goals. So knowing that having had some advice on how to eat healthily and also how to maintain exercise and activity, we sometimes still find ourselves in the position where we actually have to manage some of the effects of degenerative or other conditions that can develop, and we still need to have the medical practitioners as part of the treatment team if we're looking at healthy weight. Our final speaker before we go to the panel is Professor Veronica Preda, who's the head of the discipline of endocrinology here at MQ Health, and that includes the Healthy Weight Clinic. Those of us that know Veronica know her as an extremely energetic, intelligent and talented person who's got a number of research interests herself, and who undertook advanced endocrinology training both at Royal North Shore and at the Oxford Centre for Diabetes. She also has a PhD in another branch of endocrinology. I'm going to let Veronica speak to us now. Thank you.
Thank Professor Wilcox for coordinating all of this, and to my lovely colleagues in the clinic, both in and outside of work, Carly and Valentina, so thank you for the stellar effort. I'm going to move more towards the management, medically speaking, and how we deal with managing weight and coping with COVID, the challenges and some of the potential solutions. As during this time of the COVID pandemic, we've seen, as we talked about earlier, much more time at home, boredom and stress eating, and a lot of also mental health issues. And we're going to talk about some of the literature behind what we've been doing, some of the literature that we've contributed to with our weight clinic. And I think this talk is very timely as we re-emerge out of the pandemic and learn to live with COVID, and what are some of the solutions and challenges. So thanks for inviting us all here tonight, and hopefully we can share some of our thoughts with you. So in terms of the size of the problem of expanding waistlines, we know from the Australian Institute of Health and Welfare data in 2018 it was classified that 67% of Australians are overweight or obese. And this current situation is expanding, and COVID has been an enormous issue on all of us dealing with weight, and as we've heard about that as a function of what we're choosing to eat, as well as our movement. There's an area that was addressed as part of being asked and invited in the ABC newsreel earlier in January of this year, to do with what and how we manage weight at Macquarie. And so I've just put up a link to that with the ABC of how we manage weight in the clinic and what measurements we use. We typically go by a BMI based category of where people fall to be able to classify people into a healthy or unhealthy weight. But there is certainly different racial origins of that, and it's based around only a Caucasian population, which is not necessarily reflective or indicative of all the different cultural groups that are represented in our country. So we need to individualise our therapy and think about our patients individually and where they sit with their metabolic health and what other comorbidities that they have. So in terms of diagnosing weight issues, we discuss it in medical contexts around certain parameters, and I won't go into a lot of detail around that today. Suffice it to say that generally we classify a BMI of 25 to 29.9 as overweight, and beyond that different categories of obesity. And with that comes the comorbidities that Professor Wilcox was talking about, that we manage from the medical end at the end point, rather than what we should be doing, which is practicing preventative medicine. And that's a major problem around the world, and it's a major problem for our governments as well, who usually like to put band-aids on things rather than investing in preventative care, which is a large area of what we do in our clinic, and a large area of what we should all be thinking about as we try to manage our own health and prevent the complications of weight and weight issues, be that physically or psychologically as well. And so globally, we know that 2 billion adults are actually overweight and 650 million odd are obese. We know that that is associated with not only enormous health costs, but also costs to lost productivity. So it's really important that we think about this, that say, for example, in the Chinese economy, $1.3 trillion is associated with lost productivity secondary to weight and obesity. So that's quite a bit of our iron ore when we think about that for our government. So far that hasn't resonated with the policy changes in supporting more preventative healthcare, but hopefully it will in time if we move as a society to try and work on our sustainable environments as well as sustainable healthcare and preventing disease, which is what a lot of us are about. Both Valentina mentioned how we can prevent disease in what we're putting in, and Carly in what we're burning off, that if we could do that, we would prevent a whole lot of issues. We know that it's not just a simple equation, and that what drives obesity is the neuroendocrine dysregulation of energy intake and energy expenditure, plus a whole bunch of other complex issues that also involve the hypothalamus, the brainstem, the gut feedback, our actual adipose tissue that we think of as a relatively innate organ when it actually is a very active organ, the liver, our pancreas, and then moving on to different disease states and the other insults that get attributed also in people's healthcare, be that psychological or a combination of psychological as well as physical, that sets them back from achieving good health all round. And medications in addition can also have a weight negative rather than a weight positive effect as well. So they're complex hormonal as well as neuronal pathways that regulate both food intake as well as body fat mass and muscle mass. And it's about the interplay of these and targeting different parts of that pathway that we can harness above and beyond the diet and lifestyle and use some of our additional therapies that we've traditionally used for other reasons to also help patients in their weight loss journey. As part of that, I think it's really important to think about the patient where they're at in all their other health issues, and that obesity is not a one-stop shop. As Professor Wilcox mentioned, communication in obesity care is essential, and it starts often with the visit to a patient's local GP, and care can be fractured, and it's really important to have a patient have good care with their GP, and the GP to feel comfortable with also being involved with our care, such as the setup that we've got at Macquarie, where we have a clinical care coordinator that coordinates between our dietitians, our exercise physiologists, our GP, as the centrepiece to help coordinate all the different stops along the way. And it's not a simple linear equation. There are lots of stops along the patient journey, and we know that we have to have a lead, which is in patient-centred care, and that is often with a patient's general practitioner. So I encourage all my patients to build rapport with one GP or one particular GP practice, because that allows them to then have really like the tram conductor or the station master, somebody coordinating all the care so that they can achieve optimal health outcomes rather than fractured, discontinuous care where they're going in often loops and circles and often yo-yo dieting and not achieving their health goals. So I think it's really important, like many other health issues, GPs are really our frontline station masters for all of us, and obesity needs to be considered in that complex care model as another complex care condition that needs to be coordinated between all of us. So if we think about what's in the literature, as Carly and Valentina have mentioned in some of the work that they've brought to you this evening, there is a major issue in obesity care that it takes time to talk about obesity. And Professor Wilcox mentioned that in his consultations he may not have the time to go into all the nitty-gritty of what one specific patient needs to do in all the different areas to address the dietetic side, to address the exercise physiology, and then the metabolic syndrome side as well. And weight carries a stigma as well, so there's an enormous psychological component as well. So it involves all of us, and one study that was actually from Professor Catterson's, an Australian, well-renowned Australian dealing with obesity for many years, has published the ACTION-IO study, which was the first cross-sectional non-interventional study that extracted some of the data around primary endpoints towards the perception, attitudes and behaviours around dealing with obesity effectively in primary care and healthcare provision. And it's really important to understand that you need to build rapport with your patient, and it's the number of consults, much the same as other chronic conditions, that really helps us to achieve that. And the goal setting that we've talked about, both in the dietary components as well as the exercise, and getting those outcomes, reflecting on those outcomes, and helping patients to achieve realistic goals at an individual level. And so there was a delay for about 6 years on average for patients to get to the point where they dealt with dealing with the issue of their obesity, and a mismatch between the motivations for weight loss, such as to be fit, their perception of how they are viewed, versus the medical comorbidities that often as doctors is what we want to deal with. So it's really important to think about the goals and to build rapport with our patients. So this was our publication recently of what is clinically meaningful weight loss and why does it matter, and how many visits are useful. And this was from our own Healthy Weight Clinic with our team in the Healthy Weight Centre. and it reflected on the first 3 years of our clinic between 2016 and 2019, and those patients who came to clinic and what was meaningful weight loss and where we could achieve better outcomes and reduce their comorbid conditions. And essentially, what was the upshot of our study was that building rapport with patients, the longer we kept them in our chronic care model, the better they did, the more weight they lost and maintained off, and the more that we could reverse their comorbidities. So you're more than welcome to read that in Clinical Obesity. I've just put the reference up there. And that gives the long-term data behind what we do, and it's one of the largest as well as longest studies that we've got here in Australia in a clinic such as ours, outside of any of the public healthcare models that often can't operate the way that we do. So the key impacts are both mental and physical on health-related quality of life, and that those with the biggest BMIs did lose the most weight, but we had most people moving a class, meeting clinically meaningful weight loss goals of more than 5% of their initial body mass. Our Healthy Weight clinic is located here in Suite 302, and it is a clinic that's comprehensive and multidisciplinary, and we have the benefit that we have not only allied health on site, we have specialists, and we have the surgical specialties as well for bariatric surgery and the capacity to move between the two and follow up with all our patients. So within our clinic, as I said, we cover a lot of the comorbidities that are related to obesity. And so patients who might come with an initial, for example, one the other week was a lady getting worked up for lung transplant, but she has issues around weight, naturally an inability to do a lot of exercise at this point as her lungs fail her, but we need to optimise her health, her weight, her diabetes prior to receiving a lung transplant and make her the best recipient possible, that she goes through that operation well when she gets there. So it's about a multidisciplinary approach to all of these patients. And it employs specialists across a number of domains, and we're all co-located on the university campus, and we have the capacity to therefore debrief between each other and communicate rather than have fractured care, which often happens with lots of disparate providers in lots of different locations. So we know that there's a large role for dealing with weight in both what we eat, how we eat, and timing of activity. We also need to think about medical adjuncts. And I don't need to tell you, and many people out there would have seen some of the lay press with some of the newer medications that are not so new in actual fact, about that help with weight loss, and the different classes of therapies that are available to certain cohorts of the population, such as our diabetic cohorts, that we have available that also have pleiotropic effects beyond just glucose lowering. They also help with weight control, and they would be things like the GLP-1 receptor agonists that some of you may be familiar with, that are not on PBS specifically for weight, but do have a really significant weight benefit. And there are a number of other medications that we use as well in their different individual contexts. And that goes back to my previous point that appetite is a complex issue. It's governed by both hormones as well as emotions, as well as other medications interacting, and a complex number of other issues. And we can turn that up or turn it down by harnessing some of the clever chemicals to act on the hormones that we already have to feedback to make us not feel hungry. And so it's really important to think about what our goals of obesity management can be, or weight management overall, and the dietary approaches to healthy eating, not chronic dieting, and teaching people to live well long term and to maintain a healthy weight. So as we mentioned before, there are SMART goals for exercise. We also have the goals in the medical side of assessing patients according to their risk and what their other comorbidities are, the strategies that they have, and working through those and re-evaluating them as they shift between different cohorts with their weight and where they're at in their journey with their other medical illnesses. So I think it's important to think about that. If we think about our diabetic patients specifically, we like to classify things into different boxes because that's what we do, as Professor Wilcox mentioned. We like to label stuff because it makes it easier for us to understand. So if we think about diabetics, we think about diabetics as having potentially sensitive muscles and sensitive livers to our medications, but some of those will have resistant muscles and resistant livers to the effects of insulin, and vice versa, and you can move those playing cards around to get different combinations. And fundamentally, type 2 diabetes is an insulin resistance problem, whether that's an organ-specific issue or a global body phenomenon. And in that, we have to manage patients and their weight in particular and think about what medication would be most useful to fix that diabetes successfully and to get that HbA1c down, but more importantly, to also help get the weight down to deal with the underlying problem and not just a band-aid fix of providing a script and that's the end of the story. So we always need to evaluate our metabolic patients, and we have different phenotypes. And I'm not going to bore you with the details of different phenotypes, but we've got to think about different tissues, and that's what we're talking about tonight, about skeletal muscle, one of our largest tissues in our body that we need to try and get more of, because that will reduce the insulin resistance. And that will fundamentally raise your ability to control your metabolic health and control your weight long term by building muscle mass, which is what we like to see in our clinic as an outcome measure rather than just a number on the scales. So we think about chronic disease management programs for our patients, and that is key with the help of our GPs. We think about what pharmacotherapies would support weight loss in conjunction with dietetics and exercise physiology goals that are measurable and sustainable with all our patients. So I think it's important to balance what we can do with pharmacotherapy with both the nutrition, physical activity to engender long-term behavioural changes in our patients and the community at large so that we can live better. And we know that across all the different management weight programs, there are successes and there are failures. And our successes here that we've managed to contribute to the community have been with long-term follow-up and long-term goal setting and with comprehensive holistic care. And that way we've been able to not only see our patients as a one dimension of a number on a scale, but to move patients' well-being across from a worse stage of health to a better stage of health. And it's better to move a patient from one stage to the other and into stage 0 of obesity so that we can actually reverse the other comorbidities, get the blood pressure down, get the cancer risk down, get the osteoarthritis improved, get the fatty liver all improved so that we can deal with the patient comprehensively rather than unidimensionally. So I'll leave you with what we do here, and improving outcomes also include the largest burden of disease in Australia, which is cardiovascular disease. And everybody should know what their BMI is and what it means, but it's not a one-stop shop and it's not the only measurement that we use. No one country has a long-term comprehensive strategy to deal with obesity, and our government leadership is essential. And we could be a leader in Australia, that would be nice, but currently the elections are on and I don't think that's their focus. We would really like to have medical involvement with our leaders, both locally and nationally, to deal with the size of our problem, both pre and post-COVID, and to achieve targets so that we would punch better and not above our weight, but below our weight for the rest of the world. And that one size never fits all. We've got to make things made to measure. And that's what we do here in our clinic with the help of all my colleagues here who have come out tonight. And I'd like to acknowledge our team, and particularly the people I've worked with since it started, Simon and all our team members. We've got new team members as our clinic expands, and also our bariatric surgeon whose vision was one of the visionaries who really encouraged me to come here, and that's Professor Lord, who's currently in theatres but had wanted to pop down. I wanted to thank our entire team who've worked with me over the last 6 years now that we've been doing this.
Thanks so much, Veronica, for that very comprehensive explanation of how important the linkages within the teams are. I'm going to invite the presenters now to come up and we're going to move to our question and answer session. Thank you and welcome back. We're going to take a couple of questions here now. One that's been posted relates to another very important aspect of Australian society, and that's alcohol intake. And the question is, can you comment on alcohol intake? Everything in this country seems to revolve around alcohol, and it's culturally embedded to an unhealthy degree. So I might go to you, Valentina, initially.
That's a really good question, and I think in terms of alcohol, one of the dangerous things about the drinking in Australia is that it's not that we tend to have to drink every single day. We actually found a recent study that Australia is the drunkest country in the world. When we drink to get drunk, and we consider that binge drinking once you have more than 4 standard drinks in one occasion. So when it comes to reducing our alcohol intake, for some people they benefit from being completely sober and not having any alcohol at all and relying on non-alcoholic drinks. And for other people, they prefer to just have it in moderation and aim to have 1 or 2 drinks when they're going out socially with friends. I think it's really important, if you are trying to reduce your alcohol intake, to rely on your family and your friends and the people around you, and to seek out help from a health professional as well.
And Carly, any perspective from sort of the relationship between alcohol and physical activity?
I think not directly, but if you think indirectly, the effects that we do have from alcohol and when we drunk or prolonged use of it, it's going to reduce our energy levels, it's going to increase our weight, reduce our mobility, so it's going to make us not want to exercise. So if you're struggling to find any motivation and you're having a look at your activity levels and your diet habits, and you find that alcohol is a big part of that, that's probably a contributor to why you're feeling so sluggish, why you're not wanting to move. Cutting that out, cutting that down can definitely help.
It certainly can be a demotivator. We know that it can act as a depressant.
Yeah.
Veronica, what are other ways to measure weight besides BMI, particularly for short or tall people, as BMI can be misleading? And also, why is it harder for slimmer people to burn calories compared to heavier, or is that an urban myth?
So to deal with the first part of the question, so other measurements that are really helpful rather than just BMI, and first of all, BMI actually comes adjusted for ethnicity. So we actually have to look at the cohorts according to your ethnicity. For example, as I said earlier in the talk, the Caucasian population is where our usual BMI cutoffs that are standardly quoted are used. It doesn't discriminate between genders, and it doesn't, at this point in the general ones that are accessible, discriminate against targets for Asian ethnicity versus Polynesian, Aboriginal, Torres Strait Islanders, Indigenous people, for example, where they've actually got a higher BMI category that is healthy based on their skeletal structure versus an Asian population based on a slimmer skeletal structure overall, where the BMI cutoffs generically are actually lower. So just that's the first point. Secondly, in clinic, what do we use? Well, we find it far more helpful to use body composition, and we've been doing that at Macquarie across a number of different disciplines, including our cancer care modelling. And Louise Kohlmeyer, for example, who leads our lymphedema service, uses it a lot in her cancer patients to see where people's muscle mass, water balance, etc. sits. And so we piggybacked off that over 6 years ago and started doing that in our clinic when we set up the Healthy Weight Clinic, to actually see what the changes over time, if you go back to Valentina's talk, is weight is not a one marker, and weight is obviously part of that BMI calculation. It doesn't matter what your actual weight is this morning versus this evening, versus you've been to the bathroom, you haven't been to the bathroom, etc., or it fluctuates from day to day. It's the trajectory of muscle mass versus fat mass. And that's what drives the insulin resistance, the higher fat mass. So what we look at in the clinic is actually by bioimpedance modelling through machines that can measure it, is what is the body composition of an individual? How much skeletal muscle have they built through Carly's help of better sustainable goals to develop muscle mass and better eating with Valentina? So what have we achieved there? Are we building muscle mass and not losing muscle mass at the cost of just seeing a number on the scale go down? Because that actually builds health, it builds telomere length, it builds longevity, well-being, etc.
Thanks. I'm aware that we've reached the conclusion time for this particular webinar. I'm just going to pose one last question that's been answered, and perhaps to Valentina. Someone's asked, I'm interested to hear your opinion on so-called detoxes such as juice cleanses and practices like 16/8 intermittent fasting. Do these actually have a positive effect? And you've already said that the underlying principles, I think, don't change in terms of healthy eating, but what's your response there?
In terms of detoxes, they tend to be things that give us a laxative effect. So it's that temporary weight loss from that us losing water. So that's really not loss from fat mass. So that's not what we're looking for. And in terms of intermittent fasting, there are definitely benefits in terms of reducing our calorie intake because that window is smaller. But the problem is, I find that some people end up just overeating in that small period and then feeling like they're not energized throughout the day and they're not moving, like Carly said. So I think it really depends on the individual, and this is really where that individualized advice is really important. Yeah.
But to that point, I think it's important because it's something that I know you talk a lot about with your patients, is also as we head into sort of that sundowning effect, many of us stack in the evenings when we're most insulin resistant. So the theory behind intermittent fasting, as many people find, is that if you choose a window in daylight hours before the sun sets that you're allowed to eat, and you're not allowed to eat after dark and then your 16 hours of fast start, that is really helpful for you to reduce your insulin resistance and to actually achieve better weight loss. So it is the timing, not just the quantity of calories. And so it can be quite effectual in stopping you from mentally not eating if you can work to that clock. But the trouble is, many of us work during the day, get sidetracked and then stack in the evenings because that's our reward behaviour.
Yeah.
Absolutely true. I hope this has been a very useful presentation or series of presentations for the audience tonight. I'm sure it has been. I'd like to thank on your behalf the presenters tonight. They've put a lot of work into their presentations, and I thought it came across as a very cohesive explanation of how we gain weight, but also more importantly, how we can manage that weight gain. I'd also like to thank the team behind the presentation tonight who actually got this webinar organised and running on behalf of MQ Health. And finally, I'd like to say MQ Health welcomes any questions or feedback on the presentation, and obviously very happy to see any patients interested in these services. Thank you again.